was in a group with Karina Timmermans and Abby Vetch, and I'm going to be talking to you guys a little bit more about kidney stones. So let's start by talking about what kidney stones are. Kidney stones are hard deposits made of minerals and salts that form inside your kidneys. The minerals and acid salts stick together in concentrated urine. They can be painful when passing through the urinary tract, but usually don't cause permanent damage. There are multiple factors that can increase your risk for developing kidney stones, and these include family or personal history. If someone in your family has had kidney stones, you're more likely to develop stones too. Also, if you've already had one or more kidney stones, you're at increased risk of developing another. Dehydration. If you are not drinking enough water each day, this can increase your risk of kidney stones. As a community, we live in warm and dry climates at times, so for those of you who sweat a lot, you are also at higher risk than others. Certain diets. Eating a diet that's high in protein, sodium, and sugar may increase your risk of developing kidney stones. This is especially true with a high sodium diet. Too much salt in your diet increases the amount of calcium your kidneys must filter and significantly increases your risk of kidney stones. Obesity. High BMI, large waist size, and weight gain have been linked to an increased risk of kidney stones. Digestive diseases and surgery. Gastric bypass surgery, inflammatory bowel disease, or chronic diarrhea can cause you to get kidney stones. And this causes the digestive process that affects your absorption of calcium and water, increasing the amounts of stone-forming substances in your urine. Certain supplements and medications, such as vitamin C, dietary supplements, laxatives, and calcium-based antacids used to treat migraines or depression can also increase your risk of kidney stones. A kidney stone usually will not cause symptoms until it moves around within your kidney or passes into your ureters, the tubes connecting the kidneys and the bladder. If it becomes lodged in the ureters, it may block the flow of urine and cause the kidney to swell and the ureter to spasm, which can be very painful. At that point, you may experience these signs and symptoms: severe sharp pain in the side and back below the ribs, pain that radiates to the lower abdomen and groin, pain that comes in waves and fluctuates in intensity, pain or burning sensation while urinating. Other signs and symptoms you may experience include pink, red, or brown urine, cloudy or foul-smelling urine, a persistent need to urinate, or nausea and vomiting. Pain caused by a kidney stone may change, for instance, shifting to a different location or increasing in intensity as the stone moves throughout your urinary tract. Kidney stones often have no definite single cause, although several factors may increase your risk, like we have talked about. Kidney stones form when your urine contains more crystal-forming substances, such as calcium oxalate and uric acid, than the fluid in your urine can dilute. At the same time, your urine may lack substances that prevent crystals from sticking together, creating an ideal environment for kidney stones to form. Prevention of kidney stones may include a combination of lifestyle changes and medications, and these can include drinking water throughout the day. For people with a history of kidney stones, doctors usually recommend drinking enough fluid to pass about 2 liters of urine a day. If you live in a hot, dry climate or you exercise frequently, you may need to drink even more water to produce enough urine. If your urine is light and clear, you're likely drinking enough water. Eat fewer oxalate-rich foods. If you tend to form calcium oxalate stones, your doctor may recommend restricting foods rich in oxalates. These include rhubarb, spinach, sweet potatoes, nuts, tea, chocolate, and so on. Choose a diet low in salt and animal protein. Reduce the amount of salt you eat and choose non-animal protein sources such as legumes. Consider using a salt substitute such as Mrs. Dash. Medications. Medications can control the amount of minerals and salts in the urine and may be helpful in people who form certain kinds of stones. So if your doctor suspects that you have a kidney stone, you may have diagnostic tests and procedures such as blood testing. Blood tests may reveal too much calcium or uric acid in your blood. Blood test results help monitor the health of your kidneys and may lead your doctor to check for other medical conditions. A urine test may also be performed, and this is just a 24-hour urine collection that may show that you're excreting too many stone-forming minerals or too few stone-preventing substances. Imaging. Imaging tests may show kidney stones in your urinary tract, and an ultrasound is another imaging option to diagnose kidney stones. The doctor may also analyze your past stones, and this is just done if you may be asked to urinate through a strainer to catch stones that you passed, and then the lab will analyze and then reveal the makeup of your kidney stones, and this will just be used to see what's causing your kidney stones and form a plan to prevent more kidney stones from coming again. So most small kidney stones won't require any invasive treatment, and you may be able to pass a small stone by drinking water, pain relievers, or medical therapy. Kidney stones that are too large to pass on their own or cause bleeding, kidney damage, or ongoing urinary tract infections may require more extensive treatment. Procedures may include using sound waves to break up the stones, surgery to remove very large stones in the kidney, using a scope to remove stones, or parathyroid gland surgery. Following up with your doctor will depend on how frequent your kidney stones become. If you form stones often, you will need monitoring with x-rays and urine studies to be sure no new stones are forming. Your healthcare provider will monitor you to make sure your medications and diet changes are working for you. Overall, the outlook for kidney stones is very positive, although there is a risk of recurrence. Many kidney stones pass on their own over time without needing treatment from your healthcare provider. So that is all I have for you today. If you have any questions, feel free to ask me. Otherwise, this is the source that I use, and you can feel free to check that out as well.